Hello, everyone, and welcome to Beyond COVID, the new podcast from Compassion in Politics, where we try to take a step back from the horror and heartbreak of the current crisis to ask, what are we learning from it about how we all live? Can we build back better after the crisis? And what opportunities does it provide to do things differently? My name is Jennifer Nadel and my co-host is
Matt Hawkins, and today we are very excited to be joined by Professor Michael West. Michael joined the King's Fund as a senior fellow in 2013 and became head of thought leadership in 2015. He is Professor of Work and Organisational Psychology at Lancaster University Management School, Senior Research Fellow at the Work Foundation, Visiting Professor at University College Dublin, and Emeritus Professor at Aston University. So, keeping very busy. Michael, how are you coping during the lockdown?
Well, thank you for inviting me to join you on this podcast. Very well, really, because family and friends are showing great compassion. It's also true that this is a moment when spring is bursting forth and there's a great deal of joy in that. At the same time, I think I'm aware of a kind of constant hum of background anxiety and fear for elderly parents and parents-in-law, for family, for my own health and well-being. That background hum sometimes is a little bit louder and sometimes a little bit quieter. So there's this strange juxtaposition of both a lot of beauty and love and also fear and anxiety and awareness, I suppose, of the huge suffering of many people around in our communities and societies as well. So it's, I suppose, this holding all of those things together and staying close, I think, to compassion, which is core in all of this.
And you, of course, have concentrated a lot in your work on the impact of compassion in healthcare. How important is compassion and how available is it in the health service at this moment?
From all of the research evidence we have, and really over the last couple of years, I think there's been a much more profound and deeper understanding about this. Compassion is the most important intervention, the most powerful intervention there is in healthcare. There is nothing that comes close in terms of its power in affecting patient outcomes and patient satisfaction, and it also has a significant impact on staff well-being. So compassion is important not only in terms of patient outcomes, it's also important in terms of staff well-being. So when clinicians are compassionate in their interactions with patients, that has an impact in reducing the anxiety levels of staff themselves, depression levels, stress levels of staff themselves. So compassion towards patients, compassion towards each other has an impact on the well-being of clinicians themselves as well.
On the question of the impact of compassion, is this something we can measure? And in particular, how do we measure it in terms of healthcare?
So there are two ways that we can measure compassion. One is in terms of observing the way that people behave. The other is in terms of the outcomes in healthcare. So in some of the research, compassion is rated by people observing clinicians in their interactions with patients. Sometimes it's rated by patients themselves in terms of their experience in their interactions with clinicians. But we also see that the outcomes are very clear in terms of quality of care. So that we see, for example, in relation to, if you like, the treatment of diabetes, that control over blood sugar is much better when clinicians who are treating patients are more compassionate. It's clear in terms of the treatment of AIDS, in terms of the likelihood of finding the virus in the bloodstream when clinicians are compassionate. And even when we are working with people with terminal illnesses, that when clinicians are compassionate, survival is significantly longer. So we have many examples of the consequences of compassion, as well as being able to measure compassionate behaviours amongst clinicians.
And is this something that we can put a numeric value on? Can we sell it as something that will actually save money?
Yes, so cultures of compassion in hospitals are associated with significantly lower costs within hospitals. We also see that there is less likelihood of people requiring extensive treatment when they're clinicians treat them with compassion. There is less need for chemical interventions with people overall when they're treated with compassion by their clinicians. So there, both in primary and secondary care, there's clear evidence of the financial savings associated with compassion as an intervention in healthcare.
In the midst of this terrible crisis, when the demands are so great, how easy is it for those in the health service, those on the front line, to work with compassion?
Actually, the evidence tells us that now more than ever, what we should be doing as leaders, as clinicians, as colleagues, is encouraging compassion. In other words, listening to each other, tending to each other, understanding the challenges that we face, empathizing with each other, and then taking action to help each other. And the more we can collectively create a culture and climate of compassion, particularly at this time, the more likely it is that we will get through this most effectively in terms of the quality of care we provide for patients, in terms of the ability of staff to sustain themselves over this period of time, and in terms of people's ability to manage the inevitable fear that we talked about earlier. Because when we feel that those around us are being compassionate, that they care for us, that they're seeking to help us, climate of safety within this context of fear.
Do you think that on the whole, politicians have modelled that type of compassionate leadership?
This is a moment where the light can come streaming in. There has never before, I think, been a time when all of humanity has faced such a global shared existential crisis. It's an opportunity for us to come together, I think, and to reflect on the way that we make sense of our existence, the way we interact with each other, the way we are as a species in relation to the planet, other species, each other. And politicians, I think, play a key role in that. You know, one of the, I think, defining features of human species is our tribalisms. And tribalism has served us well in many ways because it's enabled us to band together and to protect each other and to raise children and acquire resources. But it has a very dark side. And it feels that that dark side threatens us now more than ever in terms of the way we interact. And I think we see that exemplified in our political systems as well. The way that people have joined tribes and identified themselves with one tribe or another and denigrate the other tribe. We see it, I think, very starkly in the United States at the moment, which appears to be in almost some sort of, not even ideological, but tribal civil war. And I think our politicians have a great responsibility to model a sense of interconnection, a sense of compassion, a sense of community at this time more than ever. I feel really powerfully that this is an opportunity for us collectively to change the way that we exist in this planet and how we manage with each other. This is a moment where the light can come in, and I think we have to seize that opportunity. And politicians, key leaders in our society, I think must model that courage to bring about real change.
And Michael, if you were offering advice to our political leaders at the moment about how they could use this moment for real positive change, what would you be saying to them?
Firstly, model compassion in the way that they interact with each other and with society. And that means that first and foremost, our politicians must model listening with fascination to each other. Nancy Klein's lovely phrase, listening with fascination, being present with each other. And secondly, then seeking to understand the challenges that our society faces, to understand the positions that different people take in terms of their life experience, and to bring the quality of empathy to all their interactions as leaders, because that gives them the motivation for the fourth element, which is helping. The advice I would give would be first to model those behaviors, then I think that there are probably half a dozen key issues I would pick out. One is we need to emphasize our interconnection. As a species, we are all interconnected throughout the world. We need to emphasize our interconnection with other species. We need to emphasize our interconnection with the planet rather than always seeking to differentiate. And that, I think, has implications for how we deal with inequalities in our societies and around the world. Second, we have to really address the issues of climate change, the climate crisis, and biodiversity. That's part of that recognition of interconnection. I think we also have to take a hard look at our economic systems that have been built on the idea of growth and productivity, which means, in effect, continuing to exploit the resources of our planet just for the sake of exploiting those resources and creating ever more material stuff, rather than emphasizing interconnection and the need to conserve and sustain our planet. And also, I think connected to all of this and connected to tribalism is the tendency to discriminate against other human beings and other species, and it's fundamental that we address those issues as well. I would pick those out as key areas that politicians should be focused on. And I would also say that, people will say, well, this feels idealistic, we're not going to change. What I see over the last 4 weeks, 8 weeks, 12 weeks around the world is people have changed their behavior in the most dramatic, astonishing way. We can change. We just need to make sure that we sustain the changes in the right directions once we come through the worst of this pandemic.
Thank you, Michael. And I am just going to pick up on one particular aspect of what you mentioned there, which is inequality. We've seen that COVID has had a disproportionate impact on poorer communities. What should we be doing now to both reduce inequality and also to minimise the discriminatory effects that something like COVID can have on those poorer communities?
So let me pick a particular area that I think is very telling. We've seen that the COVID crisis has taken the lives, for example, in the United States and in the UK, the lives of more people from Black and minority ethnic group populations. We see also that the lives of more people, of our staff from Black and minority ethnic group populations, have been taken as a result of this crisis. What we can conclude, I think, from this is that the impact of racism in our society on people's health and well-being generally is enormous. And the data are really clear that it's not only the socioeconomic conditions, it's the weathering of people's bodies and minds through everyday acts of discrimination. It's the lack of access to housing, education, jobs. It's the constant battling with a pernicious force of discrimination in our society that has created the conditions for greater susceptibility. We also see that many more, for example, Black and minority ethnic group staff proportionately are in the front line of our health services rather than at the higher echelons proportionately. What we see in our society is the consequences of a particularly pernicious force, which is racism, upon outcomes during this COVID crisis. I think what we have to do is to address both the structural factors and the cultural factors that affect these outcomes. So, for example, in relation to discrimination, it's about ensuring that people from minority ethnic group background don't have to make 70% more job applications to land a job successfully, that they are able to get access to housing, to good jobs, to support. But it's also the micro behaviors that we all exemplify in our day-to-day lives. So there's something about all of us in our society taking responsibility for each other. I think all of us should be setting objectives in our lives for how we interact with people from minority ethnic group backgrounds. We're going out onto the streets every Thursday and clapping and banging saucepans and ringing bells, and it's so moving. It brings a lump to my throat every time. But we should be remembering that many of those staff we're clapping and applauding are from BAME backgrounds, minority ethnic group backgrounds, who are suffering disproportionately. So in addition to clapping and ringing bells and banging saucepans, we should be committing to treat people from minority ethnic group backgrounds with more civility, more respect, more compassion, more warmth on an ongoing basis, and renewing that commitment, I think, every 6 months to ourselves, so that we're not just changing the structural factors, but changing the way we interact. So that's an example, I think, focusing on a particular group, and we need to bring that kind of both structural process, systemic thinking to how we deal with inequality generally within our society.
And of course, leadership has a big role to play in that, which is something that you've written about and been studying throughout your working life. What hope do you have that we can see a different form of leadership emerge from this crisis?
What is fascinating about compassionate leadership is that it is the most effective way we can lead. And that's really encouraging, I think, and reassuring. We know from the last 60, 70 years of leadership research that the most important skill of leaders is to listen. And we know that the most important task of leaders is to help those they lead do the jobs that they want to do. Take the example of healthcare. it's delivering high quality, continually improving, compassionate care. Those 4 behaviors of compassionate leadership, listening, understanding, empathizing, and helping, emerge again and again in leadership research as being critical to effective leadership. And it's not a coincidence. It's because compassion is core to us as human beings. We need to belong. We need to have a sense of connection to be well. You're more likely to die from loneliness than you are from the effects of smoking or obesity. Belonging is core to us, and compassion is the means by which we connect with each other and have that sense of belonging. So compassionate leadership is absolutely the most effective form of leadership. And in this crisis, we are seeing that compassionate leadership is absolutely core. And my hope is that our leaders at every level, in every society, in every country, come to understand that this is the means by which we create more equal, more connected societies where people feel a sense of belonging rather than exclusion, where people feel a sense of safety rather than fear, and where we reinforce that sense of interconnection at every level and go against the trends that we've seen over the last 100 years of separation, of tribalism, and of fear that I think has haunted our species and caused us, I think, to behave so astonishingly destructively to other species and to our planet. In fact, it's not our planet, it's the planet which we are a small part of.
Absolutely. Thank you, Michael. Slight change of tack now. Can you tell us what has been the one thing you struggled with most during the lockdown, and what has been your go-to comfort for dealing with it?
So I think the thing I've struggled with most is my mother lives 10 minutes away from me. She's 93. She's very fit. The right thing to do is for me not to go and visit her. I nevertheless feel really guilty about not seeing her. I do go up occasionally to deliver some shopping and talk to her from the garden. 10 days ago, her brother died. I was not able to go up and tell her because my wife was away looking after her parents. And so I had to tell her by phone. And then when I eventually did go up, I couldn't hug her in her grief. And I felt really guilty about that. So I think the guilt of not being able to hold people you love is although it's irrational and illogical, it's nevertheless real for me. I've taken huge comfort from sitting out in my garden and seeing the insects and listening to the birds and spending unhurried time with all of that and with my wife. That feeling of love and beauty in nature and the feeling of belonging, connection, love with my wife those have been really just enormous sources of comfort.
Thank you for sharing that, Michael. Must have been very hard.
Finally, if there was one message you could leave our listeners with, what would it be?
Compassion is core to what it is to be human. Compassion's core to our ability to connect with the planet and the world around us. Compassion is our nature. It's vital that we model compassion in our interactions, but that compassion begins with self-compassion, of paying attention to ourselves and understanding the challenges we face in our lives and our work, of empathizing with ourselves, of caring for ourselves, and of taking wise action to help ourselves so that we can be the best that we can be and stay close to the core values that give our lives meaning, like compassion that enables us then to have deeper and more authentic connections with everybody that we interact with and work with.
A huge thank you, Michael West, for talking to us about life beyond COVID. And next time, we'll be talking to the philosopher A.C. Grayling. He'll be telling us about the moral and ethical issues that the crisis has raised, as well as giving his verdict on how political leaders have managed the crisis. So we hope you'll join us then. Beyond COVID is part of the Real Agenda Network, produced by Kitty Horlick and brought to you by Compassion in Politics. We would love to hear from you, so please do get in touch with any comments or feedback. You can find us online at compassioninpolitics.com. And of course, we'd also love you to subscribe and spread the word about the podcast. You can find us on Apple, Spotify, or any of your other favourite podcast providers by searching for Compassion in Politics. Thanks for joining us, and we look forward to being with you again soon.